Well, hello. Welcome, Dr.
Hi,
Vishal.
Jan. Good evening and namaste.
Namaste. So my name's Julie Lewin, and I've been a medical intuitive for the last 38 years. And we have Dr. Vishal Rao. Could you introduce yourself, please, Doctor?
Thank you, Julie, first of all, for inviting me over. I think this has been a long pending discussion we both had. So
Mhm.
I'm a surgical oncologist. I'm currently the country director for the head and neck surgical oncology program at HCG, which is a chain of cancer centers. I also I work with the state and the federal government in various aspects on cancer prevention and public health, which has been my passion for reducing cancers. And an ardent advocate of holistic, integrated, and complementary healing. So, thank you for inviting me over. I think it's such a joy to share these thoughts with you. I remember our last interaction a couple of years back, I think, but
Yeah.
it was so memorable. I think this particular series of our discussion is going to open up a whole lot of discussions, debates, and maybe a lot of opening avenues for healing for our cancer patients. So
Mhm.
thank you for your time. I appreciate it.
Oh, you're welcome. And I'm looking forward to where our conversation leads. So, today we want to talk about moving from cancer to healing cancer. So, I would like for you to tell me what your thoughts are about healing cancer. I remember from our conversation a couple of years back that this is a particular interest for you because you've worked with people that have had stage 4 cancer and they've experienced radical healing, and you're very curious about how does that happen. So why don't we start the conversation there, because I know that radical healing is possible from cancer, and that it's not just one thing. So I'd be really curious as to what you've discovered in the time since we last spoke about radical healing, and let's see where we go.
Interesting. Thank you. I think to open up the discussion, Jan, Louis, the the most relevant point for me was every time I interact with the patient family or a group, I keep hearing this word: don't worry, be strong, fight your cancer.
Mm,
This is almost every third conversation that I hear a family, a caregiver, or the patient himself telling me, Doctor, I'm strong enough, I'll fight this.
mm-hmm,
And I counterintuitively tell them, look, do not fight your cancer. It's an internalized process. Start healing it. You know,
mm-hmm.
the funny part, Julie, about the modern medicine is that we tend to outsource our body to an oncologist to actually give them the treatment. And
Yes.
in that outsourcing, some way we forget that it's your body that you're outsourcing, and you have no clue of what's going on with your body or what somebody else is planning for your body.
Exactly.
Now, that's a very strange phenomenon. And I keep telling people, even if you look at stage 4C or like the serious
Mm-hmm.
metastatic cancers,
Mm.
10 to 15% of the body may have tumors, but 85% of the body may be actually good cells.
Yeah.
Now, it's so important for us to understand that when we talk about this kind of terminologies and use the word, let's say, I'll fight this cancer, I'm going to overcome it. I think we bring in a lot of negative vibrations into the discussion.
Yeah.
And that's been my learning over the last 2 decades, watching all kind of patients from across the world who have approached me, reached out to me. Some of them who have taught me, whom I call the statistical outliers. These are the people who inspire you to learn. So this, I think, conversation is going to be more about what patients taught me than what I learned from my books.
Yeah. Please
And
share.
one, yeah. And one of the most interesting things for me was introducing the word healing and not the word fighting. So I have eliminated the word fight, kill from my dictionary. And
Yeah.
I keep reiterating it to the patient's family to say, I think it is time that you look at healing your life and healing your cancer,
Yeah.
not fighting your cancer.
Yeah.
And now this kind of leads us to the next conversation from the patient side who says, but I've always been told I have to be strong and I have to fight it. So I often explain to them in a very simple manner that, Julie, all of us today, I'm saying me and you sitting today, we both started off in our mother's womb as one single cell and became a trillion cell in 9 months.
Yeah.
We were faster growing than cancer.
Mm-hmm.
But nobody called us a tumor. Nobody called us with any negative terms. We were all given the most endearing, positive, loving terms before our birth.
Yes.
And unfortunately, today, the one single interesting thing in science that it has never been able to decode is why is your immune system unable to detect the cancer
Mm.
when your cancer cells are growing?
Yeah.
And intriguingly enough, the answer for that has been that the immune system knows that they are your own cells. So when you're talking about your own cells, all kind of negative vibrations, negative thoughts, and the outsourcing approach is something that we need to remove. And the word healing begins with not outsourcing, but insourcing. You go into a
Yeah.
mode where you take stock of your life, you
Yeah.
take stock of
Absolutely.
your body.
Yes. 100%. And that's my work right now, is the insourcing. It's the inner journey. It's the looking at what thoughts that you have, what fears that you have, what is going on inside that people don't see outside. And it's so important that we do that inner work to feed ourselves the good vibration, the positive vibration. And I have said for the last 38 years, if I'm smart enough to create a cancer cell, I'm smart enough to heal the cancer cell.
Yes,
We're a magnificent machine that whatever you create, you can revoke. Whatever is in your body that isn't serving your body, you can transform that. But you can't outsource that transformation. And
absolutely.
yes, you can go to a doctor, you can have surgery, you can have something cut out, but whatever it was that was going on inside of you to create that tumor or that disease or whatever it was, the doctor can't cut that out. The doctor can't cut your thoughts out. The doctor can't transform the stress in your life. We are responsible for the stress in our lives. We are responsible for the things that happen in our internal world. And I think that what's happened is society has kind of pulled us in this direction of, as you say, outsourcing responsibility for all the things that happen that way. And that's broken. That doesn't work. So we have to go in. We have to inspect what's the common denominator here in any
Absolutely.
disease. And it's me. And I can track back through my journey every time I have outsourced my place in the world, that stress has happened. And that stress builds like a crescendo within this body. Every single time I've allowed myself to repeat that pattern, I have got cancer or a disease. And I'm getting good now at recognizing the shifts in my body, and I go, oh, I'm doing that thing again. And I reverse and I do the inner work again, and I do the visualizations and the speaking to myself, and my body recalibrates. And I've got ultrasounds and x-rays that prove that you can do that in weeks and months. You can totally revoke things that you're growing in your body in a short space of time based on, like, two cells come together in the womb and then they duplicate until we grow this human baby. That happens quite fast in the scheme of things. We can do the same as a human outside of the womb. And I'm excited about exploring what you've discovered and what I've discovered, and seeing where that can kind of come together like this and help people on that journey, right?
Absolutely. So as we were talking, I was remembering that I was once doing my rounds in my hospital, and I was on the bedside of one of my patients who seemed quite dull. He was going through chemotherapy, and I just sat down to have a conversation with him, and I asked him. I said, "So can you tell me what's the name of this drug that you're being given?" And he's like, "I don't know." And I'm like, "Okay, do you know the drug's dosage?" And he's like, "No idea." And okay, at least do you know what's the mechanism of action of this drug? He said, "No." I said, "Now think of it." I said, "You are going through a treatment in which you have completely outsourced your body, and you have no clue of many of the times either the drug or the mechanism of action or a thing, but you've put some implicit trust in a doctor, which is very good, knowing that he knows best. But I would always advise you to also reclaim some part of this. 10%, yes, outsource, agreed. 90% don't outsource. Now that's where the insourcing begins. And I think that's where the beginning of the conversation of healing should start. Where I say that my IQ, my EQ, and my SQ have to be synchronous.
Yeah.
My intelligent quotients, my emotional quotient, and my spiritual quotient, when they are in sync, that is when I feel the access of healing is invoked.
That's amazing.
So over the years, I think this has been taught to me by several patients whom I realized very interestingly walk this path even in terminal illness, to just see them years later to say that there has been some kind of a immune balance. And this immune system is such a wonderful thing that you can talk to internally within yourself. And I think holds the secret. And I remember some of the very interesting words by Dr. Judah Folkman, who's considered the father of angiogenesis. He said something very interesting. We will someday reach a point in history when we will coexist, like diabetes, like hypertension. We will not have to kill the cancer cell. The cancer cell need not kill the immune cell, but they may be working in harmony. But I think taking a cue from it, I think what we were talking at that time was also talking about healing.
Yeah.
It was talking about a kind of internal synchrony which was happening inside the body between the immune cells and the cancer cells, to talk about a kind of love, healing, peace that actually brings out harmony.
Yes. I love that. It brings the harmony.
So I think, sometimes beyond the stage of the disease, beyond, it's the mind that triggers a kind of process. When I'm told I'm in stage 4, and the mind starts to create that kind of that kind of an atmosphere for the body to begin the dying journey. And I think that's the ultimate beauty of understanding healing, and understanding the fact that even a person who's in terminally ill state, sometimes I've seen them reverse. I think the worst that I've seen is sending a coffin back, because the coffin was ready for a patient. He had to He had to be, everything else was told that there's nothing more possible. He was on a ventilator too. I was all often told by one spiritual master about the healing touch, and he often used to emphasize on this. He was to bring a patient with him, and during these conversations, he would actually talk to me. And one of the beautiful things that he told me was, he said, "Doctor, do you know what does this healing hands actually do?" He said, "These healing hands have a lot of vibrations of every
Mm.
doctor, of every person who believes in this intent of healing, and that comes from the prayers of hundreds of patients."
Just one moment. There we go. Yeah.
So I think the interesting part for me was sending the coffin back.
Mm.
If life could bring you to that brink, and I gave a TED talk eventually on that, actually talking about experiences on patients. And this whole journey of healing, I think we need to go a lot of deep dive into what are the things and methods that open up the healing for us. And there are several pathways to healing.
Yeah.
I think each of this has to be customized based on a patient's personality, based on the culture, based on where they are, where their disease status is from, and their outlook. But Louis, Julie, I would like to just uh, uh, give one emphasis which I learned on the
Mm-hmm.
power of negative thinking. We often talk about the power of positive thinking, and I've always been a person who talks about the power of positive thinking until I found out that there was a special power to negative thinking. It was very strange that I have a patent on a particular theory of oncotheology where I was studying God.
Yeah.
And while I was doing that, one of the things that I built was a 21-gram questionnaire to understand people's belief systems
Mm-hmm.
and to understand how belief systems influences people's outcomes.
Mm.
Now, the most interesting finding, it's a long story for a separate topic, and I think we'll keep our audience engaged for the next coming months. But the most interesting thing in that which I discovered was I found a lot of these patients whom I assumed were very negative, had a negative approach to life. But
Right.
when I went deeper into their life, I understood that these were the patients who had the least expectations from life and the highest acceptance.
Yeah.
And I think for today's show, one of the things that I would leave behind is healing. And healing comes from insourcing, not outsourcing.
Yeah.
And the last part is about the power of reducing your expectations and increasing your acceptance allows the universal intelligence to start to communicate with you in the healing process.
I absolutely love that. And I remember you telling me about that a couple of years back. The gap between expectation and acceptance. And as I'm saying those words, I had somebody say to me, how can those kids in Africa be so happy? Like they're incredibly happy. And it's because of their expectations and acceptance that will be part of that. And
Actually,
what an
how
amazing
true.
practice to end with: expectation, lowering expectation and raising acceptance.
Yes.
I think that's magical.
Yes, yes. And I think that kind of brings us to the last part of the discussion for our audience that I think we'll keep meeting and keep discussing on various aspects on healing, of heal your life, heal your cancer,
Yeah,
and what are the pathways to healing to walk inwards in this journey to open up your own innate potential powers
exactly.
where I think between Julie and me, we are going to be just facilitators to help you understand your own journey, help you empower and look inwards, and open up that treasure trove of power of the internal healing mechanisms. And all of these, I'm sure we're going to be sharing from our own patients' journeys. These are all not patented formulas that we found somewhere, but I think it's all out there,
Yeah.
and we hope that these conversations of ours are going to benefit more and more people as they listen to it and walk this path of journey of healing.
Absolutely, because it is an extraordinary journey. The healing journey is the most magical journey, and it's a journey that the internal or the inner journey is the most fascinating from my perspective. And I encourage and endorse and embrace the inner journey for healing. And I'm so excited to be doing this with you, Dr. Vishal.
Thank you. Thank you, Julie.
Yeah. Thank you for joining us.
Thank you. Namaste.
Till next time.